afternoon, everybody. After tuberculosis, we come back to our favorite subject, COVID. So friends, global pandemic brought the world to standstill. Most of us were stuck at home for months together, working from home and being restricted to indoor posed significant health challenges. Increased number of hours spent sitting, having improper posture, lack of adequate exercises, and the stress led to lingering low back pain. But low back pain is a common disability. 80% of the population does suffer from back pain sometime during their lifetime. So was there really a spurt in the incidence of low back pain? This study from Malta indicates an increased incidence of low back pain during the COVID-19 pandemic. Another study from Riyadh showed an increase in back pain intensity during the quarantine period. There are many such studies which does indicate that there was an increase of low back pain during this period. Also, there was an increased burden of chronic low back pain because of the psychosocial events during those times, like physical distancing and isolation, changes in the social behavior and work activities, fear of infection, and unavailability of the health system. 2020, what a year it was for the food world. People who had never entered a kitchen started baking cakes, bread, making pizzas, and all this led to the incidence of obesity epidemic. There were virtual running events, there were virtual cycling events, and sports challenges like this and like this added to the injury epidemic. Just click. इसको भी click करना. And there were legends like this who had an healthy and unhealthy lifestyle suiting their needs. The findings from the Riyadh study showed that the low back pain was more in the younger adults, obese patients, stressful individuals, sitting for long periods, not following ergonomic recommendations, lack of physical activity, and those who are teleworking. The COVID pandemic had an impact almost on every aspect of human interaction, causing global changes in financial, healthcare, and social environment for the foreseeable future. The lockdown and social distancing helped to control infection. However, this prompted hospital and clinic closures and reduction of all non-COVID clinical visits. Despite the pandemic, there was a need to treat patients for non-COVID problems. And this prompted the government of India to start telemedicine and video medicine visits. However, the practitioners remained accountable for providing proper assessment with this new modality of healthcare delivery. This is how I did my online consultation. I sent this form to the patient to be filled up and sent back to us along with his x-rays and reports. I do a WhatsApp video consultation. I'll tell them to make a due payment, and then I send him the report on my signed letterhead. If you want a more detailed checkup, you can use this form also. Friends, the diagnosis of pain is in the pain details. 80% of the patients can be diagnosed with low back pain, or 80% can be diagnosed with history alone. I divide my patients into 3 groups, basically: simple back pain, nerve root pain, and patients with serious spinal pathology with red flags. Let's take a few case scenarios. Back pain with all movements restricted, it is spasm. Back pain with morning stiffness is probably fascial arthritis causing the pain. Back pain which occurs more at the end of the day is probably suffering from degenerative disc disease. Back pain with leg pain It is prolapse into vertebral disc. Back pain in the elderly after a cough, sneeze, or jerk. Keep in mind a vertebral compression fracture. Back pain with severe COVID, when he had used high doses of steroids and patient is immunocompromised, do rule out fungal infection. Low back pain with loss of bladder and bowel control, it is cauda equina syndrome. Back pain with fever, cough, shortness of breath, loss of taste and smell, as you all know, it is diagnosis is COVID. While fatigue, headache, chest pain along with back pain can be because of depression. Back pain with other bone pains, myalgia, especially at wrist, it is vitamin D or calcium deficiency. Low back pain with fever, loss of weight, appetite, TB is to be ruled out in our country. Abdominal pain along with back pain, the cause can be in the kidney, intestine, or the reproductive organs. Low back pain with recent loss of weight can be because of diabetes, thyroid, infection, or cancer. Friends, we also know that neck pain was as common as low back pain. Back pain after recent onset of COVID in an immunocompromised patient who received high doses of steroid, fungal infection is to be kept in mind. Back pain after a recent onset of COVID with abdominal pain, mesenteric thrombosis can be a diagnosis. Back pain with generalized weakness is classical of long COVID and it lasts for weeks or months together. Long-term problems expected after COVID are degenerative disease and its sequelae, osteoporosis and compression fracture because of high steroid use, or back pain with hip pain, it can be a vascular necrosis of the hip. And to conclude, sitting is the new smoking. Future waves are possible, so do not let the guard down. Thank you.